Hi, I'm Deanne Miller, Director of Quality Improvement and the Safety Officer for Napa Valley Hospice and Adult Day Services. This is the Safety in Service for all new employees and the annual requirement video. You should all have handouts that have all the slides that I'm going to show on the PowerPoint today, so we're going to get started. So, you should know that you are responsible for your own safety. I can lecture you about safety all afternoon, but I can't make you be safe. So it's everyone's responsibility to follow the directions that you're given in this video and to be responsible for your own safety and to do the right thing. So what is your employer responsible for? Your employer is responsible to make reasonable efforts to protect the health and safety of all of our employees, volunteers, patients, and participants, to provide a safe workplace for you, to provide information to you about health and safety hazards, and to identify and correct any health and safety hazards and encourage employees to report hazards. So we have a responsibility to try to keep you safe, but you have a responsibility to do the right thing and be safe yourself. Responsibilities by employees are to keep themselves informed of conditions affecting their health and safety, participate in training programs as required, adhere to safe practices in the workplace, and to report to their supervisors any potential hazards in the workplace or any injuries and/or accidents. Today we're going to talk about several safety topics, including bloodborne pathogens, infection control, tuberculosis, hazardous chemicals, fire safety, earthquake safety, personal safety, and driving safety. These are things that you may find while working for Napa Valley Hospice and Adult Day Services that you run into. So the first one is bloodborne pathogens. So what is a bloodborne pathogen? Well, a bloodborne pathogen is a microorganism that's carried in the blood that can cause disease in humans. Common bloodborne pathogen diseases are malaria, syphilis, hepatitis B, hepatitis C, and HIV. Now the HIV virus is the virus that leads to AIDS. It depletes the immune system. It does not survive well outside of the body. In fact, if someone with HIV is to bleed on a table, by the time the blood dries, the virus is no longer contagious. The virus is very fragile and dies outside of that nice 98.6 degree body temperature. So there's no threat of contracting HIV through casual contact. About 35,000 people are infected annually in the United States with HIV, and that's well down from what it used to be. But an infected person can carry the virus for years before symptoms appear. There is no cure and no vaccine at present. But there's only been 57 documented cases of healthcare workers occupationally acquiring HIV. So we try very hard to make sure that you don't increase that statistic. Hepatitis B causes inflammation of the liver. Symptoms can range from flu-like to none at all. And even with no symptoms, the person still is infectious and can spread the disease. With hepatitis C, that is the most common bloodborne pathogen infection in the United States. Symptoms can include jaundice, fatigue, abdominal pain, loss of appetite, nausea, and vomiting, and it can lead to chronic liver disease and death. So what are potentially infected bodily fluids? They are anything, blood, and anything that can contain blood, such as saliva, vomit, urine, seminal or vaginal secretions, skin tissues, chewing tobacco, any other bodily fluids, even with microscopic blood that you can't see. So these bloodborne pathogens are transmitted by direct contact with another person's blood or bodily fluid that contains blood via their mucous membranes, your eyes, your mouth, your nose, through non-intact skin, cuts or open areas in your skin, or rashes that are tissue penetrating, and contaminated sharps and needles. You have to have a direct blood-to-blood contact in order to get a bloodborne pathogen. So how do you protect yourself from getting a bloodborne pathogen? We encourage the use of universal precautions. Use of proper personal protective equipment, or PPE. You need to treat all blood and body fluids as if they're contaminated. I always say if it's wet and it's not yours, wear gloves. You need to do proper cleanup and decontamination and dispose of all contaminated material in the proper manner. So what is personal protective equipment? It's anything that is used to protect a person from exposure. Common things that we may use are gloves, goggles, masks, CPR mouth barriers, or aprons. You always need to remember with personal protective equipment to check it for defects or tears before using. If it has a tear or an open area, then it may not be effective. If it becomes torn or defective, remove it and get new. Remove all personal protective equipment before leaving a contaminated area, and that may also include a patient's home. And do not ever reuse disposable equipment. It is essentially that, disposable. You throw it away. So how do you know if you've been exposed? An exposure incident is a specific incident of contact with potentially infectious bodily fluid. If there's no infiltration of the mucous membranes or open skin surfaces, it is not considered an occupational exposure. If you get blood on your hands and you have no open areas on your hands, it is not considered a blood-to-blood contact. It has to be directly in the mucous membranes or in a non-intact open area of skin. If you are exposed, what should you do? If you get stuck by a needle or another sharp object, or you get blood in your eyes, nose, mouth, or on broken skin, you need to immediately flood the exposed area with water and clean any wound with soap and water or a skin disinfectant. You need to report this immediately to your employer, and you need to seek immediate medical attention. We would probably send you to our occupational health provider or the emergency room if this were to happen. Now, the hepatitis B vaccine is out there. It is strongly recommended and offered to all of our clinical employees and volunteers. It's provided at no cost to our employees and volunteers. In fact, if you don't wish to receive it, you have to sign a declination form saying that I don't want it. Since 1982, 95% of cases of hepatitis B have been decreased because of the vaccine. It's an expensive vaccine. Most children have it before they reach school age, so it's a very safe vaccine. Bloodborne pathogen rules are in place for your health and safety. Failure to follow them is a risk that you should never take. So now we're going to talk about hand washing. These are the CDC, the Center for Disease Control, hand washing guidelines. The most common mode of transmission of pathogens is via your hands. So there's substantial evidence that hand hygiene reduces the incidence of infection. So how good are we at hand washing? Well, we did a survey of our staff, and the nursing staff said 76% of them always wash their hands. The aide staff said 83% always wash their hands. The social work, only a third of them always wash their hands. The chaplain staff said 40% of them always wash their hands. And the bereavement staff either are really good or just said that they always wash their hands. So we're looking for 100% all the way around. Everyone needs to be good at hand washing. So when should you be washing your hands? When hands are visibly dirty, contaminated, or soiled, you should wash with a non-antimicrobial or antimicrobial soap and water. If hands are not visibly soiled, you can use an alcohol-based hand rub for decontaminating your hands. Now, plain soap is good for washing your hands. Antimicrobial soap is much better. But the best way to kill bacteria on your hands is with the alcohol-based hand rubs. So what are the benefits of the alcohol-based hand rubs? They require less time. They're more effective for standard hand washing than soap. They're much more accessible. You don't need a sink. They reduce bacterial count on hands, and they actually are less drying than soap and water, and so they keep your skin nice and soft. So when should you wash your hands? Before any kind of patient or participant contact, before putting on gloves, and before inserting any kind of invasive device. You also should wash your hands after any patient or participant contact, after any contact with any bodily fluids, excretions, non-attacked skin or wounds or dressings, and after removing gloves. Our policy is if you're going out to a home that you wash your hands when you get there and you wash your hands when you leave. So you're stopping from bringing anything into the patient or taking anything out from the patient into your home or your car.